Hi friends, good morning. Thanks for joining me today. It's Miss Robin again from the Denton Library. And as you can see, I'm not exactly in the library today, am I? But I am still in Denton. Right across the road from the library is the school and elementary school. And behind the school is EMS base number 4. One of the EMS bases of 8, you said? Of 8 bases?
Yes.
Of 8 bases in Davidson County. And we're going to be here visiting today, talking with a paramedic and going into the back of the ambulance and actually touring that. How fun. So thanks for joining me today. And I want to introduce you to Erica.
Hi.
And she's a paramedic here based in Denton. And Erica, tell us a little bit about maybe a couple typical calls you might receive.
So typically we run several chest pain calls. We go out and we will put people on the monitor and look at their heart and then determine if they need to go and have some work done to their heart. Sometimes they have to put a balloon in to stent their heart. And we will transport them to the hospital. We also go out for falls. Sometimes we have to help people up. Sometimes they require transport to the hospital. We also run rec calls, things of that nature. Those are typically our most common calls.
Okay. So you can do a lot in the ambulance before you get to the hospital.
Yes,
In other words, they don't have to wait to do CPR to revive the heart. They can, until they get to the hospital, they can do it right in the back of the ambulance. And so not everybody you transport to the hospital, you just treat on scene,
Yes,
but
ma'am.
some you transport, right?
Yes, ma'am.
Okay, all right. So, they treat people who have had accidents at home, their wrecks on the road, all kinds of illnesses, some of the COVID illnesses lately. You've had a lot of calls with that, right?
Yes,
People
ma'am.
who've been ill with that,
Mhm.
so, all right. All right, can we get up in the back of this ambulance?
Sure.
And you talk to us a little bit? All right.
Sure.
All right.
We'll go here to the side.
Okay, I'll follow. We'll meet you around the back.
Okay.
Turn the timer on here so we have a little extra light.
You don't want me to lie down there as a victim, do you?
So this is what we refer to as our stretcher. This is where we transport our patients. We can, if we have to, take multiple patients. A patient can lie on this bench seat or sit. This is our heart monitor. We can do what is called a 12-lead EKG, and we can determine if someone is having a heart attack or not. We also have our Lucas device, which is a new thing that we got this year. It does CPR for us. It's a mechanical device, and I can actually open it up.
Erica
Show it
was
to you.
telling me a few minutes ago that every EMS truck now, or ambulance,
Right.
in the county has been equipped with this, which actually does CPR for you, because if you've ever seen someone do CPR, it is very, very tiring, and you have to switch out with people. But being mechanical, this thing can just keep going, so I'm sure it is literally a lifesaver.
So I can't do it with one hand, but we have a board here that we would put under a patient, and then this thing just clips on, and this piece right here actually does our compressions for us.
Wow.
And it is a very, very valuable piece of equipment to have. And we're very fortunate to have those.
Yeah, that thing never tires out, does it?
Yes.
So it's awesome that the county approved those. That's wonderful. Now this stretcher actually can go in and out, correct?
Yes, ma'am.
Okay.
Yes.
All right. All right. Go ahead and just run through a few things. with this.
So we have lots of oxygen equipment on our truck. We have bag valve masks to do CPR. We can actually breathe for a patient.
Now where does the oxygen plug into?
So we actually have it mounted here at the back of the stretcher. I don't know if you can
That's
see
the
that.
oxygen tank. That's okay.
Yeah, this is our small one, and we actually have some big cylinders. I can show you that in a minute. That are out here that we can reach through and turn on, and we have oxygen here, here, and here.
Oh wow.
So when we're having to do something like CPR, we're going to use a lot of oxygen, so we're going to hook up in the truck. We can give neb treatment. And I know some of the kids probably, if they have asthma, they'll know what this is.
Okay.
They have to use the nebulizer machine
Okay.
to take like albuterol. We can give that.
So is that for kids also that might be like allergic to bee stings, or am I not? It's not.
So in that instance, if we have someone having an allergic reaction, we sometimes have to give them albuterol and help after we give epi or something like that. If it's like an anaphylactic reaction, then we have to get to give them albuterol before we get to the hospital.
Okay.
We slowly get to that point, but our first line treatment would be epinephrine.
Okay.
We have ET tubes. This actually goes in your airway, and we can actually breathe for you if you cannot breathe or not breathing effectively. We also have what is referred to as a king airway, and this is for any of the kids that might be interested in the medical field. This would be what is called a blind insertion airway device. So with an end-tidal tube or ET tube, we actually have to use, probably you've seen it on medical shows, where they use the what's called a laryngoscope. It's a metal piece of equipment where they actually stick it in their mouth and open up their jaw and put the tube in. This, we actually just take someone's jaw and just stick it straight into their mouth, and it seats itself in their proper position. And we inflate this bulb, and we can bag you that way.
Okay.
And it is something. So as a paramedic, I'm qualified to place an ET tube. This right here, this is something that an EMT with a kind of a lower qualification can do for me. If it's just me and an EMT in the back of the unit, I can say, if you place this, they can do that. Or if we're unable to establish an intubation, we can place this.
So if you're interested in a career that she's referring to, she's saying that there are different degrees and levels, certifications that you can get. And she went to the Davidson, which is now community colleges, which is now called Davidson Davie Community College, is where she went locally, which is a great place to go. So, all right, go ahead, Erica.
Let's see here. So we have our suction. This will be if we need to suction anything out of anybody's airway, any vomit or anything like that. We can do that. Trying to think. Right here is our IV stuff. We can start IVs. We can hang fluids. I'm sure you've probably seen these.
Yep.
We also, sorry, this cabinet's we also can draw blood. If someone's having stroke-like symptoms in the field, we typically like to draw blood because sometimes those things can change before we get to the hospital. So the hospital really likes for us to get that first line blood draw, so that way they can see whatever blood levels they check for. I'm not really sure what they are, but we can go ahead and get that for them and take it to the hospital and hand it off to the doctor or nurse.
So while you're en route, if you're taking someone to the hospital, you're relaying information back and forth to the hospital already before you get there. Is that correct?
Yes, ma'am. So what we do is when we get on scene, we assess our patient. We determine. Sometimes people will call for one thing, but it will be another thing going on. So it is up to us to make an assessment, to look for signs and symptoms, and use our best judgment and our education that we get to try to determine what they're telling us, try to determine what we think is going on with them, and try to establish the best treatment for them in the back of the unit. And then when we get on the road and closer to the hospital, we will go ahead and relay to the hospital that we have this age patient and we have, whatever's going on with them.
The symptoms.
The signs, the symptoms, what they're complaining of, and what we've done for them at that point. And so that way they know if they need to call in respiratory before we get there, so they know what to be prepared for when we come.
To have ready for you.
Yeah.
Okay. All right.
So back here we have all of our medications. So this is our RSI kit, or part of it. So this RSI was actually what we call rapid sequence intubation. So if someone is not breathing effectively and we've established that we need to take control of their airway, we actually can sedate someone and paralyze them and put a breathing tube in and take over breathing for them. And it is in the best I can't think of the word.
Interest
it is
of the
best for the patient.
Yeah.
Best interest, yes. So we have several different medications here that we can give.
A mini pharmacy, right?
Yes. So we have medications that we can give whenever you're sick and throwing up.
Okay.
Okay.
We have cardiac medications that we can give whenever your heart is beating too fast. This is a respiratory medication, steroid.
And I'm sure you've got lots of bandages I see in there.
Yes.
Lots of those.
Or glucose for diabetics when their blood sugar gets too low. If they're alert and oriented, sometimes we can give them this if they're talking to us.
Now, how is that administered?
So we just open the tube and squirt it in their mouth.
Oh, okay.
If they're conscious enough but kind of, a little out of it, we can feed it to them, and if they can take it from us, then that's usually the best. Now we can, if their blood sugar's low, we can start an IV, and we can give them D50 through an IV. Now this is a example of a lot of times of a treatment that we come out to somebody's home and we treat them, and a lot of times they don't go to the hospital because we have essentially fixed the problem. We see that a lot.
Now, is it up to the patient whether they go to the hospital or not, or do you recommend what they do?
We can make recommendations if they are alert and oriented and capable of making their own decisions. We can't really force someone to go to the hospital, but we can make
Certainly
a
recommend
strong recommendation of what they should do.
Yeah.
Yes.
All right. What if you had someone walking outside this time of year and they were bit by a snake? Kind of what would you do?
Well, around here we don't actually have a lot of venomous snakes.
Okay.
So we just really just transport to the hospital. There's not a lot of treatment that we do for a snake bite other than just transporting to the hospital.
Okay. All right.
So there's not a lot
Where they would have the venom.
Yeah, we go
Antivenom,
to the hospital where they they can administer antivenom if they need to. But
Okay.
around here we don't really have a lot of venomous snakes.
Right. Not like some places. Okay.
Yeah, that's really not something I've seen a lot in my career actually.
Okay.
So
What is the most common call you get with kids?
Typically we get the fevers that the parents can't get to break.
Okay.
And so we either will go out and we'll make a recommendation of, what a parent could do and try to help them. Sometimes it's a new parent that's just not familiar. And we'll try to help them. We'll even call the pediatrician for them and talk to them and see what their pediatrician recommends. Sometimes we'll transport them. And then, like I said, if the parent's comfortable, sometimes they just keep them at home. But that's typically a lot of what we see.
Okay.
You were asking about bandage stuff. So we have lots and lots of bandage stuff here.
Ooh, I like that stuff.
Yeah.
Big bandages too. Wow.
This is our multi-trauma dressing. This is for big bleeding.
So you might use something like this at a wreck. Right?
Yes.
Okay.
Yes. And this is our burn sheet.
Oh, okay.
If anybody ever has burns over a large part of their body, we have to cover them with this.
Keep it sterile and clean.
Yeah, and it helps keep them warm and stuff. And that's the big thing is don't let them get cold.
All right, we got a couple minutes left. Erica, anything else you want to touch on that you can think of that I don't know to ask you?
So we do carry medications that we can help stop seizures.
Okay.
So I don't have those on this truck because this is a spare unit. but we do treat seizures. We do a lot of cardiac stuff in the field as far as like CPR, like a lot of cardiac medications that we can give.
Okay.
I think that's pretty much it. This field, I say, is very diverse.
Okay.
We deal with a lot of different things. No call is the same. Everything is 100% different every time we go out to a call. So it's ever changing. We never see the same patient twice.
So it's not a boring job, to say the least.
No. You like I said, you get something different every time. With what I do, we do a lot of the things that a lot of people don't realize. We do a lot of things in the back of this truck that can be done in the hospital as well.
Mm-hmm.
And I don't think a lot of people realize that we can do a lot of cardiac care in the back of the ambulance that we can do.
And that saves precious time, I'm sure.
Yeah, it's highly important. And I said that to say I'm not taking away from what hospitals do. I say that to say it's very important if someone is experiencing some type of emergency for them to call 911.
Right.
Because there is a lot of things that we can do for people in an emergent situation and can prevent a lot of trouble for them down the road.
Because sometimes time is very important when there's something serious going on. And that is something else I wanted to mention to you, boys and girls, is if there's ever an emergency of any sort, medical emergency, fire, whatever, just remember the number to dial is 911. That's 911. And remember, it is an emergency number. It's not a number that you just call for fun. But it's certainly there for you to call when you need it. And if you think it might be emergency, but you're not sure, go ahead and call it. That's fine. But it will take you to a number where they can assess whether you need an ambulance or a fire truck or police or several of those. So.
Exactly.
All right. I think we're going to wrap it up, Erica. This is awesome. This is fun. I learned a lot today, and maybe it piqued a little interest for some of you thinking about your future. And thanks very much for the tour today and for what you do for everybody.
Thank you.
Really appreciate that. All right. Thanks for joining me today, and I hope to see you next week. Bye-bye.